Good morning, and welcome to our weekly COVID-19 update briefing on Patriots Day, September 11, 2020. Unfortunately, since our last report, we've had an increase in positive cases in the parish. We're up now to approaching 3,000, a number of 2,861. That's an increase of 133 since our last report. Deaths have increased by 8, so we're at 100 deaths in the parish as of this morning. The state is approaching 5,000 deaths. They're at 4,991. Yesterday, Thursday, September the 10th, we received great news. Governor Edwards verbally announced that the state shall progress to Phase 3 of the recovery effective September 11th. The state has met the federally mandated gating criteria a third time, which is a prerequisite to move to Phase 3, and he should, if he follows his normal routine, he should be publishing the proclamation this afternoon and commenting on his scheduled 2 p.m. media conference today. The governor has emphasized that the gating criteria guidelines, which allowed us to move to Phase 3, must continue to be followed. The COVID-19 pandemic has not ended, and now that we are in Phase 3, we just have to continue doing the things that we've done in Phase 2 that are in the federally mandated guidelines. And I will repeat those, or review those. They're all for a period of 14 days, and they are a downward trajectory in flu-like illnesses, a downward trajectory in corona-like syndromic cases, a trajectory of documented cases, or downward trajectory in positive tests as a percent of total tests. And all hospitals must be able to treat patients without crisis care, and a robust testing program must be in place for healthcare workers, including antibody testing. So what can we expect in Phase 3? We'll be going by the federal guidelines, and the governor may very well refine these in his briefing today, but in accordance with the federal guidelines, the things which allow us to go to Phase 3 and what we can expect is as follows. There can be no evidence of a rebound of positive cases. Next, we must satisfy the gating criteria a third time, which we did. We should continue to vulnerable individuals can resume public interaction, but should practice physical distancing. And just by way of clarification, vulnerable people is considered by definition as persons aged 65 or more, and individuals, and I will quote, individuals with serious underlying health conditions, including high blood pressure, chronic lung disease, diabetes, obesity, asthma, and those whose immune system is compromised, such as by chemotherapy for cancer or other conditions requiring such therapy. Quote. So that's the definition of vulnerable in accordance with federal guidelines. Again, in Phase 3, low-risk population should consider minimizing time spent in crowded environments. Next, employers may resume unrestricted staffing of work sites, but they must continue in accordance with the guidelines to do temperature checks, social distancing, disinfecting services, and those same things. That hasn't gone away. Next, visits to senior care facilities and hospitals can resume, but the cost of those who interact with residents and patients must be diligent regarding hygiene. Large venues such as sit-down dining, movie theaters, sporting events, and places of worship can operate under limited physical distancing protocols. Gyms can remain open if they adhere to standard sanitation protocols. And lastly, one of significance that's had a lot of attention, it mentions that in Phase 3, bars may operate with increased standing room occupancy where applicable. And I sort of suspect the governor may comment on that, it's also, I think, important to note that the governor cannot make anything less restrictive than the federal government, but he is allowed to make them more restrictive. Not that he would necessarily do that, but that's the way it's organized. Young adults, people 18 to 29, and children continue to account for a significant number of new cases, having to do with, in large part, the opening of amusement-type venues and not following the mitigation prevention protocols and such things as the Memorial Day weekend and then more recently the Labor Day weekend. We may experience some negative results if the protocols have not been followed, similar to what happened after Memorial Day. And again, I state and underline that COVID-19 has not gone away. It is directed and important that we continue to do face coverings as before. And as a reminder, that's everybody age 8 and older. And it's even suggested that children under 2 is recommended but not mandatory. It's estimated that 40+% of the people have are asymptomatic. They have the COVID or do not show any symptoms, but they can spread COVID to anybody, relatives, friends, family. So people, even though they don't think they have a problem, they got to be mindful of the fact that they can very well cause serious illness or death if they don't follow the mandated mitigation and protocol procedures. So what can we do to save lives, improve the economy, and remain in phase 3 as we wait for an effective and safe vaccine? First, it is mandated that we continue to follow prevention and mitigation protocols during phase 3. That has not gone away. The federal guidelines have not changed, as I've stated, and the governor said yesterday, he emphasized that it is incredibly important that we continue to follow the prevention and mitigation protocols. And by way of reminder, they are wear of the mask, washing of the hand for 20 seconds or more, cough into the bend of your elbow, do not touch your face, disinfect frequently touched surfaces, comply with social distancing of 6 feet or more, and if you're sick, stay home and follow the guidance of your medical provider. Also, it's strongly recommended that with flu season rapidly approaching, we all get flu shots, even folks who normally like to get them. It's highly recommended that everybody get them so we don't compound the problem of having serious flu outbreaks. At the same time, we may have serious COVID positive outbreaks and the result on the ability to medically serve that population. The effect of the Labor Day weekend remains to be seen. It's probably going to take the next 2 weeks to see how we are impacted. We can only hope that the number of positive cases does not cause the governor to have to back to a phase 2 or phase 1. But we got to be able to meet those gating criteria, and if we don't, the potential does exist. There also remains a subject of interest having to do with absentee balloting for the upcoming national election on November 3rd. Yesterday, the State Attorney General, Jeff Landry, issued his opinion on this subject, and I'll quote it. He states that, quote, a quarantine order while awaiting correction. A voter who is diagnosed with COVID-19 or is subject to quarantine order while awaiting COVID-19 diagnosis would qualify to vote absentee so long as a medical professional certifies that the voter is disabled. That sounds reasonable, but I'm not sure that that's the final decision on it, but it has been issued by the Attorney General yesterday as his position on this issue. In summary, ladies and gentlemen, our ability to move to phase 3 is great news, but we must not let our guard down. We must continue the prevention and mitigation protocols if we're going to be able to function safely in phase 3 and not be forced to return to a lower phase of the recovery. As I alluded to earlier, I anticipate that the governor will further refine and clarify these issues in his media conference, which is scheduled for today at 2 p.m. This concludes our briefing for this week, ladies and gentlemen. Our next briefing will be Thursday, September the 17th. Thank you, and have a good day.